In today's Beginner's Guide series, I'm going to talk to you about our OCD treatment with hypnosis. Now, OCD is an extremely debilitating form of anxiety. And if you're suffering from the condition, it can be extremely hard to know where you can get help to try and at least lessen or manage your symptoms. In fact, it's well known now that less than 10% of adults who have OCD are actually in any form of treatment whatsoever for the problem. So that means most of our clients will have lived with the issue for years and years before they sought help with therapy. We aim to assist our clients using hypnosis to manage the symptoms of OCD, to reduce the stress of anxiety that's associated with it, and also to get to the root cause of why someone may have the problem. So if you've ever had traditional therapy for OCD, it would probably have involved cognitive behavioural therapy, CBT. This is a form of therapy that is giving you some rational steps that you can take to reduce your obsessions or compulsions. But the difference between hypnosis and CBT is quite vast, because what CBT doesn't do is help you to understand why you have the problem. And we at Balance Hypnotherapy believe that is a really important step in the OCD recovery process. Because when you understand why your mind is doing something and why it's making you do a behaviour, it takes away some of the fear that is attached to the problem. And this alone can give you an immediate relief. And more importantly, it helps your brain to start to rationalise your behaviour from a new perspective. And when your rational brain starts to catch up with what your other brain, your subconscious brain, has been doing, it can begin to change the way you think, the way you feel, and the way you behave. Now, if you've been suffering from any form of anxiety, we should point out that we do have some simple steps that you can start using at home alone without any therapy help to try and manage your anxiety, panic, or OCD symptoms. We have our free 5-step formula to manage anxiety and panic on our website on this page, and it's a free resource for you to use in your anxiety reduction journey. So feel free, if you want to download that now, just to start you on the process of thinking about how your brain is working and how you can start to use tips and strategies to start to control some of that yourself. So let's look at some practical steps that we may take with our clients to help them overcome OCD with hypnosis. So let's imagine that your brain is compelling you to do something or to think in a certain way. Let's give the example of a common one that we see with OCD is that your brain is making you want to wash your hands repeatedly because you fear that you may contaminate someone or hurt someone or give them germs because you didn't do it. And if you don't wash your hands, your anxiety will begin to rise, and eventually it will make you feel so uncomfortable that you're compelled to wash those hands again. Now, if we take the CBT approach, what they'll probably try and do is get you to prolong the period between washing your hands so that the fear rises and then falls again. And the idea would be that you would try and make the gaps between washing your hands longer and longer. And this, of course, can be helpful. But what it doesn't do is get to the bottom of the problem as to why the person is washing their hands in the first place. What we do is put our clients into hypnosis, normally on session 2, and start a process of questioning them so that they feel relaxed enough to tell us the information that's hidden in the back of their mind. So I'll give you just one example of a client of mine who had a fear of contamination. She was worried about infecting other people with germs. And part of the reason we found out under hypnosis was because when she was a little girl, her baby sister had died. She was only a child herself, and she blamed herself in some way for the death. She had nothing to do with it whatsoever, but the child didn't understand that at the time and felt that they may have done something wrong or contributed to the death of her sister. And that fear that she could hurt someone like that manifested itself in a fear of contamination or hurting someone else. And that became an obsession with cleanliness. When my client understood exactly why she had the problem, her anxiety levels dropped significantly. And that was because her adult rational mind could step in and now challenge the old thought pattern was there. No matter what form of OCD our clients have, there will be a rational explanation behind it. So it doesn't matter if it's a fear of contamination, checking, hoarding, symmetry and counting, or intrusive thoughts. Find the underlying reason, reduce stress and anxiety, and it can have a significant impact on the OCD symptoms. All of our clients who come to see us are taught self-hypnosis for OCD or anxiety reduction, because that can also help change the intensity of the anxiety feelings. Think about it. The more stressed and anxious you feel, the more likely it is that your symptoms will start to get worse. Teach yourself how to get calm and relaxed, and your obsessions and your compulsions also reduce. Now, we have our Ultimate Self-Hypnosis Anxiety Program that you can buy on our website, which consists of 5 audios to help you to learn how to 1. Relax, 2. Reduce anxiety, 3. To stop worrying and negative thinking, 4. To reduce feelings of panic, and 5. To help you sleep. Sleep's important because when you're not sleeping properly, it means that you're tired, you become more irritable, and your brain isn't thinking in a logical pattern. It means that your anxiety will rise. So that's an important step in the process. This audio program is given to our clients, or certainly certain audios depending on what we believe is best for them when they come in for their sessions. But you can also buy this audio program in our online store, and you can use it at home and try a little bit of self-help for OCD to see if that helps you. We know that OCD recovery is entirely possible, and using a combination of deep relaxation, therapies such as CBT and hypnosis to resolve the root cause of the condition, you can start to make positive changes to the way you think, feel and behave. If you want to chat to us about OCD or any other form of anxiety, you can simply call us on 01636 650 521 and we'll be happy to have a chat with you. We run sessions not only in our clinics in Nottinghamshire, but also online worldwide. So you can see us on Skype, FaceTime